Hi, my name's Taylor. I'm going to be the caseworker working with your mother, Mrs. Georgia. I understand that she's been living at the independent living facility for about 2 years now. Recently, we've noticed some changes in her behavior, which is why we called you here today. We've noticed that she has consistently missed quite a few of her lunchtime meals at the facility, and that's not very typical for her. She's generally pretty social and stays on her schedule. We've also noticed that she's been just a little bit forgetful here and there, forgetting. One example was that she forgot to close her door before going to bed. Someone noticed and contacted us, and we took note of that, checked on her. She was a bit confused. We understand that you guys live about an hour away, but this past weekend, when her grandson, I believe is your son, came to visit her, she continued to call him by your name, mixing the two of you up, which is also not typical for her. It's not typical behavior. Looking over at her general medication list and physical health from her last visit at the doctor, everything physically was looking fine. She was on 2 medications, one for blood pressure and one for arthritis. The way we are seeing the situation is possibly that she's having some kind of cognitive impairment. Right now, we don't think that it's very severe. We would like to get her to her doctor and get a full workup, probably some neurological testing, brain scan, urinalysis, see what could be causing her confusion. We want to try to rule out anything medically if it's something neurological, or rule out anything neurological if it's medical. So what they may do is a series of memory tests called an MMSE, and it's to test for dementia. They may ask her to recall some words from a list, draw a clock, check her orientation, ask her if she knows where she is, what year it is, her name, birthday. So if we are correct in our theory that this may be early signs of Alzheimer's or dementia, she may start developing some other symptoms, and then we would have to further check into her living situation. She wouldn't be able to live at the independent living facility anymore. She would need a little bit more, need somebody there more often to check in with her. So some of those symptoms that we might start noticing and we need to keep check on: she might start forgetting some recent events. She could have some difficulty planning her day-to-day activities, remembering appointments. She may have some issues remembering the order of steps in a typical daily task that she's normally able to do. She may show bouts of confusion, not knowing where she is, what day it is, maybe even what year it is, and some disorientation. Sometimes they can be a little temperamental because they're confused and they're not sure why. And so in that situation, if those things do begin to develop and the physician decides that this is a long-term problem like dementia, we would probably suggest somewhere like memory care, just because she would be more one-on-one, have more assistance, and they would be able to help her in ways that our independent living facility would not be. But we will follow up with that physician and keep in touch with you and the rest of the family. We're also going to ask around some of the other nurses here and doctors and just see if they've noticed anything out of the ordinary. That way we have a full picture of what's been going on with Miss Georgia, and so that we can fully understand it.